We're into the letter B's, and dear God, everyone's favorite, bipolar disorder. You know how I said the whole free world just likes to be an expert. We like to throw around these psych terms. You're bipolar. You're delusional. Next time someone calls you one of those labels, ask them, what does it mean? I guarantee you they're going to just stand there and eventually, well, it's just moods. You're just crazy. Not on this channel. Okay, so bipolar disorder, as the name implies, the prefix bi meaning two, polar meaning opposite. So your moods go from one to the other in these extremes. You're either manic, vocabulary time, boys and girls. You're either manic, which is just these unbelievably high bursts of energy. Not high as in crack pipe high, but excitability, and you're just through the roof, kind of like Hammy from Over the Hedge, mixed with a little bit of Chicken Little. The sky is falling! Yeah, like caffeinated energy. And then you have the depressive side. That's why I used to be called manic depression. You have the depressive side where you're feeling sullen and kind of low and you're down. But trust, and we'll get to this later, you can be depressed and have a smile on your face. You probably say, how in the heck is that, AJ? We just keep listening to the word depressed and you think you're down, you think you're crying all day under the blanket eating a tub of Chunky Monkey. That's not necessarily the case, but a lot of times, yeah, you are sad and you're unhappy and you're just feeling kind of bleh. The thing with the bipolar disorder, it's one or the other or both, and you're shifting vocabulary. You have these episodes and these swings, as they say. You go between one and the other, and that's why it's a mental illness, because this is persistent. It's ongoing, like several times throughout the day, you know, upwards of 2, 3, 4 times a week or longer. And sometimes it's precipitated by something, and sometimes it isn't. Open book quiz, y'all, Friday. Triggers. What sets you off? What are you responding to? What makes you, and I'm careful with this word, snap? What is it physically, mentally, a thought, a memory, person, place, thing, smell, your family history, or maybe in your environment, what's going on in your everyday life that just finally took its toll. So then we think of symptoms. What is characteristic of that particular illness, or that, I guess you could say, sign or indication of what is wrong? And then we look at what do we say, triggers? Yeah, triggers, diagnoses. Well, that implies plural, not singular. But yeah, you have a diagnosis. Basically, what the heck is wrong with you? What has it been officially declared that your diagnosis is? And the thing with these illnesses, like I said, you have symptoms that are kind of similar for so many of these illnesses that it's really hard to diagnose. Speaking of which, a lot of the textbooks say that, you know, a person can develop bipolar disorder maybe mid to late teens up until, you know, your mid 20s. But also I guess you could say any time in your adult life as well. Again, it just depends what's going on that finally took its toll, or sometimes it's not triggered by anything. And this is the reason why I really have an issue with folks being diagnosed as children. You're already moody. You're already going through different developmental phases. You respond to everything emotionally. Your frontal lobe, remember the lobes we were talking about for, you know, that's responsible for emotion, response, risk-taking, choices, memory. It's already in overdrive. So I hate to hear someone who's 8 years old saying, oh, I have bipolar disorder and I'm just going to go on pills. I'm so depressed. And you may be, but that, again, isn't exactly indicative of an actual disorder. So why is bipolar disorder so prevalent? You have extremes in emotions. Everyone loves the reality shows. I know I'm always picking on them. But if you think about behavior that is really inappropriate for the situation, or some may say just completely immature for that person's age, or they tick, something just sets them off really easily. They are just heavily emotional, really, really sensitive. Yeah, that's when it's an issue, when it's affecting your everyday life, it's affecting your job, it's affecting your interpersonal relationships with other people. Is it really sensible, first of all, or really appropriate for a grown woman to sit there having a conversation with another grown woman and start shaking the table?
Crying, not a good thing. Okay, not bad for them.
And throwing things. No. It doesn't make any sense if, say, everything's going perfectly fine in your life, and not only are you under the covers sleeping all day and you don't want to get up, you don't even want to shower, and you probably figure, okay, what's going on here? It may or may not make sense. Okay, so you're going literally back and forth all the times. Vocabulary. These are called mixed episodes. You can have the depressive symptoms and you can have the manic symptoms, but when you are cycling, as they say, back and forth, then it said that you are having mixed episodes. Me, I'm seriously like a 3-year-old on espresso beans some days, upside down on a coaster out of a sippy cup. And then there are other days, and the thing that gets me, even about myself after all these years of being diagnosed, I don't know what sets me off sometimes, and that bothers me because I'm thinking, okay, I should have a hold on this, and my therapist, you know, scorns me, if you will, about that a lot. Don't put yourself in a box and say, by this time I should be over this. By this time I should be over that. Why all of these years I still don't have control over XYZ. Just know that you're processing through it and you're trying to get better. And it's just a part of the diagnosis. You can't beat yourself up about it. The thing about a lot of these illnesses is how you live with them functionally as best as possible. Now, I know mental illness is a bit different and not as severe mental illness. That's why they are termed a bit differently, but still you have to kind of try to find a way that you can manage and function on your own, or as best as possible with the meds and therapy and treatment that you have. And because so many of us, you know, you just look at the times. The economy sucks. Our education system in this country is a joke. A lot of people are losing their homes, and folks are getting more and more sensitive to a lot of things. And we see suicide has increased over the years. You know, there's just a lot of undiagnosed mental illness because you figure, hey, that's just my response to life. But when that response gets you into trouble, except for when you're really, really productive in how you live with these things, vocabulary, what they call hypomania, you know, it just kind of adds, I like to say, a workable pace. The depression is still there, but it's a much, much lower level. You don't exactly see the manic symptoms as much when you're hypomanic, hence the prefix hypo. And it's said that that frontal lobe there is not working at an extremely, you know, highly energetic or this firing that's going off on all pistons all the times type of level. So when you're hypomanic, you're seen to be most productive. You can calm down enough because you're not all over the place to be at your best, because although things are still persistent, you can focus just a little bit more because your thoughts aren't racing and all over the place. Me, I love to write. So when I'm in a writing spell, I can write till my wrists fall off. I mean, 2, 3, 4 hours. Probably, I say, minimal to no spell check. I sleep for an hour. I'm up. I'm good. That's just the whole hypomanic piece of it. So just a quick recap. When you have this here bipolar disorder, you have these shifts in moods and swings. When they are combined, when it's not one or other but both ongoing throughout the day, you're said to have mixed episodes. You have bipolar disorder 1, where it's that mania. You have ridiculously high, totally disturbing bouts of energy. And you're just, you know, like Monster meets Red Bull on 10. And then you have bipolar 2, as we were saying, that hypomania, you can calm down enough to focus. And there are, you know, certain clinicians and certain textbooks that have 1,000,001 reasons why these things are the way it is. And again, what sets one person off may not set the other person off, but across the board, when you have bipolar disorder 1, you're usually through the roof. And I mean, you're doing a jig to faucet drippings. And then when you are hypomanic, which is bipolar 2, then you know you're more calm. Okay, and then you have mixed episodes, like I said, that's going back and forth. You know, you're cycling. There's those mood swings, those episodes. I'm telling you, it's going to be a quiz on this. Can you imagine what it's like being like that all day, every day? So I just wanted to touch on just some basics about what this bipolar disorder is, what mixed episodes are, what depression is, by, I guess you can say, definition. Don't get bogged down in the textbook. Just understand how these things present. And doesn't matter how old you are, what's going on in your life. If something is triggering you to behave in this way on either end of the spectrum, if you will, yeah, it might be time to talk to someone, so you're not out here shaking tables and throwing wigs and wanting to swing on somebody and punch them in the eye just because they said good morning, and you're not doing a jig to faucet drippings for no reason at all. Then you have these hypomanic states, and you have rapid cycling, and I'm going to go over in the next video a little bit more into detail what these types of bipolar disorder are, and why it's so easy to confuse them with other things like the ADHD that I have. But attention deficit hyperactivity disorder is a bit different because, yeah, your energy levels are all over the place and it can just be on a spur of the moment, but you also have a very difficult time focusing, or you know, your attention span is very, very short. I like to say you have the attention span of a ping pong ball, pardon, and the boundaries of water. You're just everywhere. So it's really, really tricky trying to get a proper diagnosis, and it's just not going to happen from a questionnaire and a couple of pills. And you cannot pray away mental illness. You know, that's dismissive. I have a problem with that. So we've started bipolar disorder, and I have one more vid just to kind of tie it all together here. And we're talking about the lobes of the brain and all of that. Mine is just pretty much shot, because you want to talk about other illnesses. I also have epilepsy. So my thoughts are racing. I can't concentrate. I probably won't remember doing this vid in about an hour. And I've had so many head injuries because epilepsy is just, that's the nature of it. It's like shaken baby syndrome. Your brain is rattling against your skull. And I'm taking some really hard falls. But instead of just trying, you know, getting all bogged down with this, and try to live with it as best as possible to help others. Something is wrong, but I'm going to get through it. I'm going to explain a couple of things. Again, I'm not a nurse, doctor, pharmacist, or anything like that, but I'm not going to tell you what I heard. So check the description box for a couple of things, and tell your friends I'll come back. Yeah, let's have some popcorn and some Pop-Tarts, and just sit down and kind of get this thing out. I hate reality TV, but one thing that I love these days is to see more and more people in counseling. You can go on and on and on all day about, you know, I'm just sick and tired of people using childhood as an excuse. Evidently it's a problem. Any person, especially black folks, I pick on this because it's about time we stop minimizing things. You know, well, just go pray about it. It's going to go away. And you cannot pray away mental illness. This doesn't happen or go away on its own. It takes work. It takes therapy. It takes honesty. It takes getting out of denial. And what do you see when people sit on the couch? My childhood is, I didn't have so-and-so. No one told me. I don't know any better. All I know how to do is to cuss, carry on, and fight.
Bye. Not bitch. Stop it. Help.
When I was little, so-and-so did something to me, and it's always something about childhood and attachment, those early years. I mean, yeah, it could be a single traumatic event, but oftentimes there are a lot of red flags there we just don't pay attention to. So that's where this channel comes in. Stigma, stereotype. Now let's brainstorm solutions. I'm going to holler at y'all in the next video, okay? Wellness wishes. Much love.